so it's fine.
All right, cool.
Okay, well, happy Tuesday, everyone. It's 8:34. We have Dr. Lauren from Thrive Physical Therapy in San Diego. And will you just tell us a little bit about yourself and why everyone's listening today?
Sure. Yeah, I am, like you said, Lauren, Dr. Lauren. I'm a doctor of physical therapy, and I do primarily work with people who are pregnant and postpartum. That's not where I started. I started in working with like regular people, working with all the joints and all the body parts and all of that, all the different sports and stuff. And then I started working with people who were having issues with like urinary incontinence or like leaking in your pants, and they were pregnant or postpartum, and it just was like very, very unfair that these people were like bringing life into the world, and then there was no one there to help them with all these things that are you know, I don't really think like obviously with us, but back in the day, like 10 years ago or whatever, like kind of more taboo to talk about and just not known. Like when I put that post up about this is the pelvic floor, it was like one of the ones that everyone liked the most, because I just realized I'm like rambling about the pelvic floor and we don't really learn about that. So I got into that like 3 months into my career. I'm in San Diego. I own my practice, Thrive Physical Therapy, with my husband, Aaron. He's a physical therapist as well. Yeah.
Awesome. Yeah, that it's so crazy to be in an industry where you're healing people with movement, and that's not discussed. Like as if there's no anatomy down there that's important.
No, it's weird. I think we talked about it last time too. Like, I didn't know that people didn't know about like the pelvic floor. Like, I didn't know that, and I first realized that in PT school we had like one professor come in and speak for like 3 hours on it, and they taught us how to engage it and whatever and be aware of it. And like even with these like physical therapy students, like more than half of the class didn't know what the heck she was talking about. And maybe it's because I grew up dancing and doing gymnastics, and like that kind of like pull up that you do includes that. But like I also don't remember any of my coaches or dance teachers telling me to pull up my pelvic floor or you know, but it's just kind of the way movement was.
Yeah, so like you were kind of taught to like zip up. That was always my cue. They always say zip up, and
zip up. Yeah,
like I think I was doing it. I don't know.
Totally. I remember zip up and then like show your like chip and dip bowl. They would like say like your like all the like little. Yeah, exactly. So it was just like very interesting, and it's like the center of our being, right? So like, how do you not worry or talk or engage or not engage, whatever, your pelvic floor? But anyway, it's kind of like a light went off that not most people don't know about it.
Yeah, it's so important, and obviously that's why I wanted to bring you on, because I discuss it and I'm not an expert in it. So it's just very important that people get awareness. Yeah. And on this account, on Movement IQ, it's 56% male.
Hello, people with pelvic floors as well. Yes. I saw you posting that, yeah.
I almost thought it was better, because men need to realize that they should have control of their pelvic floor, and it is important. So it's not just us females that deal with carrying and laboring and birthing children. Right. So everyone has a pelvic floor.
Yes.
It's important on every human being. And whether you're an athlete or not, it's important that you know the anatomy and what all of the functions are of that area. I learned some really cool stuff on our last talk, and I just think, you know, you can never learn enough. So it's just really, really amazing. You know, in my specific situation, I didn't even have a vaginal birth, and I have some issues. Like if I'm in a squat and I sneeze, I'm definitely going to pee a little bit.
Girl, I was admiring your story yesterday. You're in a nice deep squat, and I think you had dinner at the park or at the beach, and I was like, yes, that squat. Of course, you can full deep squat, but yeah. You carried a baby inside of your pelvis for 10 months. Like, there's some stuff.
Yeah.
And then
she engaged in my pelvis.
Exactly.
So even though she didn't pass through the canal, I have issues. So I'm thinking of all these people that think pelvic floor dysfunction is only after a vaginal birth. And it's like, you could be a professional athlete, gymnast, a runner, a swimmer,
Yeah.
and have.
You could have nothing to do with being pregnant or postpartum,
Yeah.
or that's why males. I used to work in treatment as well. Now I don't as much as far as pelvic floor stuff, but yeah, I used to all the time, and it doesn't have to have anything to do with that area. So like in men's case, I did see a lot of guys who were like post prostatectomy, but that wasn't the only person I saw that had any issues.
Yeah.
Like there were things from other things, right? It's just like you can be a non-pelvic floor person, or related person, and have pelvic floor issues, or issues that could be stemming from the pelvic floor that you don't realize were stemming from the pelvic floor. And I think that's like another way that I like ran into like working with this. Like I don't have pelvic floor issues. I haven't been pregnant, but like I was working with people who had low back pain or high hip strain or high hamstring strain or like this hip thing. And it all like came back to, because as you and I strive to do, is get to the actual cause and not just like band-aids. Mm-hmm. And like it all came back to like their pelvic floor. And so it's important.
Right. And it's important for bowel movements too, people. So
yeah. All the same muscles wrapping around all the same sphincters and stuff.
Okay, so yeah, we just went on a tangent, but it was awesome. So let's just kind of go from the top. Like what is the pelvic floor and what does it consist of? And then we'll go into why we should care.
Cool. All right. So like I said, I do work primarily with birthing people. So I do have this version, which includes the vulva and the vagina. But guys, you just, take this out. There's a lot more space and muscle, and it's actually a little clearer and easier on the male pelvic floor. So, but they're really, really similar muscles. So I'll explain. But here is our pelvis. Let me back up. Hold on a second. Okay. Here's our pelvis. If I'm standing on my chair, it's like that. So here's your pubic bone, and there's like two sides of your pelvis, and they connect as one. So here's your pubic bone, and then you have this like pubic symphysis. It's like cartilage. This we call your innominate. So like it includes your butt bone, the top of your pelvis wraps around to your pubic bone. If you look at the back side, these little like points, if you dive in here, there's like little dimples. So there's little dimples in your back. This is the sacrum in the middle, and there's tailbone at the end. So there's another innominate on this side. Okay, so it's like if you put your hand on your hip like that, that's actually, you're putting your hand on your pelvis, or your innominate plus the sacrum in the back makes your pelvis. Okay. If you were to put your hand on your hip, you'd put it right here, because this is the socket for your thigh bone, your femur, to go into. Okay. So this would be putting your hand on your hip, and that would be like, that would be like here.
Right. Here. And you would put your hand on your hip, on your thigh.
Yeah. Yeah.
You would put it like way up, right?
Exactly. When I dip, you dip, we dip. A little different. So now you're gonna do that at the club next time. Don't do that. It would be very, very awkward. So the pelvis is like our center of mass, right? And so it's kind of important. It also holds all of our stuff. So in this case, I have a bladder, which I still haven't found the top to. It fell behind one of my dressers, so just go with me. There is a top on this bladder. Here's the urethra. So that's where the pee comes down, right? For this model, this is a vaginal canal, right? If we're looking like, if I was laying on my back, it'd be like this. Goes up into the uterus. And so we usually see like on a chart, on the wall. The uterus looks like that.
Laid out.
Yeah, and then there's a cervix down there, fallopian tubes, ovaries. So that sits on top of the bladder. Now again, if we're laying down like this, that's kind of the view there. I'll explain this in a little bit. I just want to show you what's inside of the pelvis. And then we have the colon, rectum, so poop, vagina, pee. And they all snuggle up together and sit inside of the pelvis.
It's so crazy how close together they are. They're like...
Yeah, and then put a baby in there, you know, for some people.
Yeah.
No wonder there's like, you know, problems with constipation and like leaking, right? Like some of the part of like leaking when you're pregnant, your baby's jumping on your pelvis. Yeah, that is one part. There are other things though. So here's from the outside view. So this is if this person is lying on their back. What you see right now is the vulva, right? So when we say, like often we'll talk about, oh, my vagina or the vagina or whatever, that's this tube that goes in here and would be in that hole. Okay, but what you're looking at from the outside is the tiny piece of the clitoris, which is a whole other thing. I forgot we said we were going to do that last time too. The clitoris is actually a very big structure and it's inside and it has like legs and again, another thing. So this is very tiny bit. That's the pee hole, vagina, and then anus, right? In between here is the perineal body, aka like the gooch, right? That area. So in males, this is just like the whole thing, right?
Oh, wow.
And then like the penis.
Yeah.
Okay. So we don't have to worry about that. I mean, there are all these other muscles too, and we'll talk about that. So this is externally. We have the inner labia here. Outer labia would be the skin part with the hair. And then we've also changed that terminology to say inner labia and outer labia, not minora, like major and minor, because the inners are not always smaller. So that's just like, let's call it in and out and just call it what it is.
So now it's easier. You're like, those are the inner labia and those are the outer.
Yes. Yep.
So for males, is it still called the perineum?
Mm-hmm. Yep.
It is. Okay.
Yep. It's a perineal body. Yeah, for sure. It's, there's a superficial transverse perineal. There's a deep perineal. There's layers of muscle, and we'll talk about that too. So that's the same. And a lot of the muscles are named similarly as well. Ours will just have the end of the name is cavernosus because it's like a cavern, or the end of the name. So bulbocavernosus, or the end of the name for men would be like spongiosis. There's like spongiosum. I wish I had a penis here because the spongiosum, like a sponge, right? Like it fills and that's what causes like an erection.
Oh, cool.
Okay. We have all the same parts. They're just organized differently. Okay. And that's the book Come As You Are, Dr. Emily Nagoski. Amazing. Read that. It says it's for female sexuality, I believe, but like it's for everybody. So we literally like in vitro, we have the same parts, they just get organized differently. Okay. So again, here we go. Boom. Let me give you another view. These are ligaments. So like oftentimes, like pregnant people will have a lot of pain back here because ligaments start becoming lax, like with relaxin. So if you're not keeping up the muscular tone to keep yourself kind of like together, these can get really strained and lengthened, especially if you're like sitting on the couch and stuff. I mean, it happens to everybody, but again, just a little bit more intensely during pregnancy. So, like remember, here's the tailbone. All this red stuff is muscle. Okay, so there's 3 layers of the pelvic floor. Okay. The outside layer is responsible for, in this version, for contraction here. Okay, like closing. Mm-hmm. And then let me just get this off.
Take off the first layer.
So there's these like triangle muscles that are responsible for closing in. The second layer is kind of like mainly fascia that goes around all of these sphincters too. Okay. And then the third layer is the elevator muscles. So they're called the levator ani. And they're more of the bowl. So when we talk about the pelvic floor, we should probably be talking about it as the pelvic bowl. And this is like for guys, if I usually would say, like, imagine you're walking into cold water and like pull the scrotum up. Yep. That's what would do this. Okay, the levator ani. Ani sounds like anus because it does go around your anus. This is the hole here. So
those muscles are big.
Yeah, they're huge, and they like go from your pubic bone. They wrap around, and they either like go and attach to the tailbone, or they wrap around the anus. Okay.
Yeah. So let me ask you this: is the second layer also contributing to closing with the first layer?
Yes,
the tissue,
but
like
yeah, because it's around the sphincters, right? But sphincters aren't always necessarily. You can't always control a sphincter, right? There's automatic, and then there's like ones you do have control of, so not always, but like so the fascia. If there's tight fascia here, sometimes it can kind of like mess with the sphincter of the urethra and cause some issues there. So we go in and try to like loosen that fascia. And as well, you know, but I don't know, not everybody, fascia is like a communicating, like working force, like contractile, like tissue, like it moves. So we do have to pay attention to it, but these outside first muscles are going to do the bulk of it. The fascia is kind of like attached to it, but it is very important to pay attention to, for sure.
Cool.
So what was I going to say? Oh, if anyone's ever seen the Squatty Potty commercials where the like unicorn's on there and then you change the hip angle, right? That's changing the angle of this muscle that like wraps around the anus. So you can imagine if that muscle is tight and there's like poop trying to come through here. I guess we'd be going that way, but you know, from your view, there's poop trying to come through here. You want to loosen or change the angle of that muscle. Okay.
So do you preach that like everyone needs a Squatty Potty? Are you like a big fan?
I'm a big fan of trying everything out. So like personally, my old house, Squatty Potty was great. New house, my butt falls asleep like in 2 seconds. It's more because of the angle, I think, of the toilet bowl.
The toilet, yeah.
Right? So you just have to be like aware of that. Like your nerves go through your butt there and your legs. And so like if you're not flexible and you're trying to get your knees up really high and you're stretching on your sciatic nerves or whatever while you're trying to poop, which is pooping supposed to be actually like relaxing. You're not really supposed to work too much. You're supposed to breathe the poop out, you know. I'm just talking about that with the patient.
The poop out.
Yeah, just nice exhale and let it come out because there's a sphincter and like it's gonna work for you. Like there's contractions, kind of like, you know, when you're delivering a baby to bring your poop out. Anyway, you don't have to try so hard. Of course, when there's constipation and there's all those other things, but if things are working, you shouldn't be having to try too hard and you can breathe the poop out. That's a good practice for labor and delivery. Yes. Anyway. What did you just ask me? You just asked me a question.
I think we did it. I just asked about Squatty Potty.
Oh, yeah. So I just like try it. It's not equal for everybody. Or like books. Or I joke all the time about like throw on a pair of like platform heels. Like takes up less space. You can feel cute. Whatever. It's just, you just need that little
hurry.
Right? A little elevation. So,
okay, awesome.
Oh, that's what I was going to say. So when I was talking earlier about like working with people who have pelvic floor dysfunction. So you might hear that everywhere. Or not everywhere, but it's just one of those like blanket terms, pelvic floor dysfunction, which is fine. Say pelvic floor dysfunction and then go to a pelvic floor therapist and we'll actually figure out the thing. But pelvic floor dysfunction can include a pain with intercourse, right? For both male and female. Pelvic floor dysfunction can include just pain down there. That can be painful erections. It can be having a hard time getting an erection. It can be you have these random shooting pains up your butthole randomly throughout the day. It can be you are leaking or having a hard time starting your stream. Okay? Like, it just is like whatever's happening down there, just go talk to a pelvic floor therapist. That's kind of what pelvic floor dysfunction is.
Right.
Because that dysfunction can be coming from tight pelvic floor muscles, right? Oops. Squeezing around your anus, making it hard for you to poop. Squeezing, like, especially if, like, we're talking about this layer, the closers, closing up and making penetration painful. Okay? There's so many reasons for pelvic floor dysfunction, not only muscular, they may show up as muscular or like a symptom. Mm-hmm. But what do you do when you're stressed out? Like, I clench my jaw, but I don't really know it. Yeah, and you do one of these, and then you like get on your phone, and then you're texting. I love your posture thing yesterday. How's your posture right now? I was like, actually, thank you, Missy.
Can you see me?
Right? We like tense our muscles, and a lot of people do actually tense their pelvic floor.
Oh, yeah.
Unbeknownst really to them, subconsciously. It kind of goes along with holding our breath, which is a really common thing when we're anxious or stressed or whatever, is we hold our breath. If you see our pelvic floor, or aka our pelvic bowl, is kind of shaped like a diaphragm, as far as like our breathing diaphragm, right? And so the breathing diaphragm and the pelvic floor should be both moving with every breath that you take. If you're holding your breath, then you lose the opportunity for those movements to happen. Some of us hold our breath and bear down, actually pushing downward, like outward into the abdomen or down into the pelvis. Again, this is relevant for everyone. And that's how, you see those crazy videos, which I actually haven't watched. I just like see them and then I don't press play, but like of heavy lifters. And I've seen more with like men, right? And they like have the blowout or whatever. That's downward pressure. Which
like when they're like PRing their lift, they crap themselves.
Mm-hmm. Or have or have some sort of like prolapse. You can have an anal prolapse. That means like the inside's coming out. There's prolapses that you can see through the vagina, which is like can be the vaginal wall coming out. The bladder doesn't actually come out, but if we look at that, like the alignment, hold on, let me get my thing. Everybody's all squished next to each other, right? So if we're talking about prolapse symptoms, they can happen from downward pressure. So let's say you have a quote unquote bladder prolapse. Your medical doctor told you that, or whomever. That might be the back of the bladder here is pushing on the front of the vaginal wall. And then the front of the vaginal wall is like coming down like that. It might be. There's numerous things.
Yeah.
Regardless, it's pressure downward and outward. Okay? Which can happen like yelling, like yelling, sneezing, coughing. Those are all expelling things, and that's fine, and that's great, but we would like our pelvic floor to be able to handle that. And it might be muscular, it might be just learning how to control the breath and not like compacting it and then sending it out or down. For pelvic floor health, I always just say, like, whatever you're doing, whether it's exercise, whether it's sneezing, whether it's yelling, like, make sure you can still exhale. Inhale and exhale, of course. Like, if you're working out, you want to breathe both ways. But you should be able to move that breath in and out. So it's not just plowing down and putting all of this pressure here. Because, like you said in the very beginning, to bring myself back around, like, why is this even important to talk about? It holds all of your organs, first of all, so we kind of want to, like, in working function, right? It's like a little trampoline for all of your organs. So if our trampoline, we're always just, like, blasting through, that's not great. We want, like, a moving, functional, adaptable trampoline. And it's the bottom of a closed container. So our pelvic floor down here, our diaphragm up here, We could also get super nerdy about it and actually make the top be our glottis, because that's where we can close things down, right? But for purposes of like just keeping it here, let's use the diaphragm as our closed container, and then we have the abdomen, right? So that keeps us with that like nice solid midsection, so we can do whatever the heck we want to do. That is also why there are some breathing patterns for lifting that are, hold your breath or push out, push your belly out into the lifting belt. That does create tension and like kind of stiffness or in this closed system, but differently, right? Like that's from air pressure, and it does put your pelvic floor at risk from blowing out, right? That sounds so crazy, but
yeah,
if you can just, I'm using that word because of like blow, like air, okay? So I understand if you're trying to PR and that's your thing, and that's very, very important to you, you need to use the things that are going to help you do the thing that you want to do, but you can't 100% rely on then having a good, healthy pelvic floor. If you need to have a good, healthy pelvic floor because whatever reason you want to have one, which could be you want to maintain good strength here, you want to maintain continence, you don't want to pee yourself or poop yourself, you don't want to have prolapse, so many things. You want to be able to, whatever you lift or whatever you do, still be able to exhale so it's not coming this way. Okay. Mm-hmm. I can talk forever, so is there any...
Yeah, so I think that's really helpful for the listeners right now to go, okay, this is what it is. You have all these bones, you have the muscles that are attached to it. There are 3 layers-ish that they could care about. So why it's important to care about it is because of everything you're saying, right? Like it's the bottom of a closed container. It contains organs. It is intimate with your diaphragm. You breathe over 20,000 times a day.
Is that, I don't even know the numbers. Is that what it is?
Yeah, it's like 22,000-ish.
Give or take. Yeah, so sweet.
I always tell people, like, think about it. If you're doing 22,000 repetitions of one thing, do you think it should be going
be like good at it?
Yeah, like, do you think we should do it well? Because if you're inefficiently doing something 22,000 times.
Oh my gosh, I'm so happy you told me that number. I need to use it. Because if 22,000 times we're breathing with our breathing diaphragm, then the same thing for this diaphragm. Because when you inhale, this pelvic floor comes down. I mean, I don't mean down like the blowout thing, right? It just like comes down a little bit. Yeah. And then when we exhale, it lifts up, which is often really different from what people think of. If I were to say, do a pelvic floor contraction, a lot of people suck up like you're sucking in through a straw. And that's great. That's a good way to practice and to like get connected. And you can do that. It's just not the like natural way that it'll be moving as you're doing your 22,000 repetitions throughout the day. So if your pelvic floor is not doing those same 22,000 repetitions, then what is it doing? A lot of the time, it's just like, it's just tight, and it's just there.
You don't know what to do. It's confused.
It's confused. Like, it's like off. I mean, not
should I contract?
Yeah, it's just like, I'm here, right? And so actually, a lot of my people, both men and women, who have urinary incontinence issues, meaning leaking, or whatever amount for whatever issue, whether it's like leaking when they sneeze, leaking when they squat, or just randomly leaking, or the water turns on and they leak, whatever. A lot of people are leaking because their pelvic floors are like this, and then that's its only, like, are you there? Okay. They're like this, and its only other option is let go. Like, there's no middle ground, right? Kind of like if you're...
Yeah, okay, so it's already like that, so it has nowhere to go.
No, it can't go. I mean, it might be able to go like this, like a tiny little baby one, but it doesn't do anything. And if we think about it as being like a movable, adaptable trampoline, you put a bladder on a trampoline that's hard, the bladder is going to like, if it's a water balloon, I'm starting to think now, kind of explode, right? Versus the bladder inside of like my hands are all messed up, bladder, trampoline. Inside of a nice trampoline to hold it as you're walking, as you're running, as you're laughing, as you're breathing, as you're whatever, right? But when we start, we're just here, this is our baseline, it's like, pee. I laughed, pee. Like there's not another option. It's kind of like if you're actually weak in your biceps and the only way to get it up is to like use momentum, like momentum. There's not like control through the movement, concentric, eccentric. There's just like slam it up, slam it down. Because you're not really using your muscle, right? So the pelvic floor, we want to have this really good excursion is the word I use a lot of the time, which is like pull it up, come back to rest, and be able to bear down. Bearing down in a controlled manner, not the blowouts, is the equivalent of stretching your pelvic floor.
Okay.
So just like your quad, you want to be able to contract it, and you surely want to be able to stretch it too. You need that whole range of motion for the most efficient use of it and the best function. And your pelvic floor is a bunch of muscles. So you treat it just like the rest of your muscles.
Treat it like a muscle.
What?
Treat it like a muscle.
Yeah. They get tired. They get like knots in them, like.
Yeah.
Anyway.
So if you could, right, I know it's a general moment, like you can't assess someone right now, but could you just walk us all through like one or two exercises that you're like, I wish the whole world worked on this every day, right? Like what are the one or two things that you just like wish you could have everyone
do? Yeah, for sure. It's one thing. So it's pelvic floor breathing. And so you don't breathe through your pelvic floor. Let's just get it straight. I'm not crazy. However, like we just said, your pelvic floor moves with your diaphragm. So I like this thing because it's 2-in-1, right? We know it's important to work on our movement during breathing, and like a diaphragmatic breath is a little bit misleading because your diaphragm is always moving, whether you're doing a chest breath or a belly breath. Okay, so I'm going to differentiate this by saying you're going to do a belly breath, but yes, your diaphragm, I want your diaphragm to move, and it will move because it has to move or else you wouldn't be able to breathe. So you can sit down, you can lie down, whatever you do.
Okay, everyone watching, you're going to do this with us. Do not observe, participate.
All right, maybe I'll stand and do it kind of sideways facing. So you're going to inhale through your belly. Let's just start there. Inhale, expand your belly. Think of it like air's going into your belly. Exhale, deflate it. Inhale, exhale, deflate it. Now all you do is like up that up a little bit. Kick it up a notch. So you're inhaling. That stays the same. When you exhale, do a core contraction. So you're pulling your belly button toward your spine. Not so much that your spine is flattening. There's a purpose for that. There's exercises like, but not for this one. You don't need to flatten your spine. So we inhale, exhale. Okay.
Now, am I also pulling up?
Yeah, so now you're going to add that.
Oh.
On the exhale, you're now going to think of pulling up. So if you have labia, on the exhale, you would think of the labia closing and pulling up on the exhale. I always say like you're lifting a blueberry. And then inhale, let the blueberry back down, expand your belly outward. And then exhale, close and lift the blueberry, but it's on the exhale, which sounds funny because I'm saying lift. And inhale, let it down. So you have to think of two things at one time. Or we exhale, pull it up. Inhale, let it down. Expand your belly. For the guys, you're thinking of, like I said, pulling up the scrotum on that exhale. So if we inhale first, you're going to let the scrotum down, the balls down as well, like the testicles inside, because they're like the weights. And then exhale, pull it up.
Okay, so for the men, you're cueing the scrotum as the exhale. There's no blueberry. They're not thinking about the perineum. It's mostly just
like from the inside.
okay.
Right, like
from the inside.
Yeah, and I mean, like I said, I haven't worked with guys in a long time, but I would still like even thinking of like lifting up a handkerchief. You know, so there is some of that closing before lifting.
Okay.
Yeah, let's go with handkerchief, but not so much blueberry because there's nothing to grab. Right? You're not like
yeah. Someone said testicles to spectacles.
Fantastic.
Okay, we have one question really quick.
Yeah.
Do you find that those that are rectus dominant experience more incontinence? Ooh, that's a good question. Rectus?
Yes.
Okay.
Not because their rectus abdominis is strong. That's not the issue, really.
Okay.
It so happens that the people that have like these great, and the rectus abdominis is the 6-pack abs, right? I think it's just more of like, I don't want to like put people in boxes, but it's not because of their rectus abdominis being strong. Like, you need them to be strong and active, and they help. I think it's just more of, that's where the focus is on getting the 6-pack, which is a lot of crunches, and crunches are fine. They only become not fine when that transverse abdominis and or the breath moving doesn't happen underneath the activation of the rectus abdominis. So if you're going for the 6-pack without being mindful of working the transverse abdominis, pulling the belly button towards the spine, again, not so much to flatten it, but to engage that deeper core. And the deeper core is the transverse abdominis, the psoas, and the multifidi. So there's a lot more going on than just the rectus abdominis. So, of course, I had to give you like a roundabout answer. It's by way of like the type of exercises or what's happening underneath a rectus abdominis exercise. If your focus is only on rectus abdominis and not what's underneath, then yes, I would say yes to your question. But you could also do both and should do both. You should do your rectus abdominis exercises, a V-up, a crunch, or whatever like that, with your deeper core activated and functioning too. And the easiest way to do that is to just exhale. Like, make sure you're breathing and think of pulling like the two ASIS is these two pelvic bones. Remember, not hip bones, but the two pelvic bones up here, bringing them together and up, and then do your crunches on top of that. There are other ways to engage the core. That's not the only way, is together and up, but let's just use that for right now.
Right. So that question, you would say yes, but for a different reason than it seems like.
100%, yeah. Okay. You're not like, oh, that person has really nice ab, like 6-pack abs. They must have issues, you know?
Themselves. Totally, yeah.
Yeah. Because exactly. It's more, I think, if they're leaking, there's that whole like, you squeeze and then the toothpaste comes out the bottom, right? But if you're active underneath it to be lifting and still breathing, because it's not just about lifting and then being tight, that doesn't do it either. So that doesn't help, I should say. Like lifting and staying lifted and super engaged and super tight, that doesn't help. You need to breathe and you need to move, and the pelvic floor has to move through running, working out, all that stuff. So it's kind of like a hard thing I get to get, because you're like, well, do I tighten or do I stay loose?
Right. You're like, no, be competent.
Exactly. It's why you need those 22,000 repetitions to fall back on, of having this like mobile pelvic floor, a functional, adaptable, the whole excursion.
Okay, awesome. So with the breath work you taught us a couple minutes ago, women focus on a blueberry and relaxing, let it go. Men pull up the scrotum
Mm-hmm.
and relax, or handkerchief.
Yep.
What would your prescription be for repetitions, and how many times a day, and for how long, and how do
All
you
of
know when
that.
enough is enough, or if I'm not doing enough, or whatever?
Right. The repetitions, all of that prescription, I even say this with my patients, like I could just throw out some numbers, but they might not mean anything to you. So your body needs to understand what the hell's going on and then like do a couple more repetitions. So if you do 3, probably not enough time, 3 breaths, probably not enough time to get your brain aware, because we're doing some neuromuscular re-education here, where your brain is retraining how to move the diaphragm up here, the diaphragm, aka your pelvic floor below, your belly, your pelvic floor muscles. So that takes some time. So right now it might take you, sit down and do it for 5 minutes. Your pelvic floor will get tired. Your pelvic floor is kind of like your eyelids, like they tire out pretty quickly. So for that whole 5 minutes, you don't have to completely pull up and pull down. And I'll say this is not like 100% Kegel and relax and 100% Kegel and relax. We're going for like graceful fluidity here. So I say like 65% at the most. Okay.
Oh, okay.
5 minutes, 3 times a day. But that's right now. Now I can do now I can do 3 of them because my brain is into it for those 3. I'm like, all right, cool. I'm good. It's almost more of like a check-in to make sure you're not this stuck pelvic floor.
Yeah.
So
and someone like me who's just had a baby, it might take me 5 reps just to become present in this moment, because there's like,
yeah.
And like 5 breaths later, I'm like, oh, now I can focus on the exercise.
Totally.
And then I might need 5 more after that to where like I think I'm doing high quality movement.
Mm-hmm.
Right. So I can see, so everyone's just going to be different. Like,
of course, and that's the thing with and that's the thing with bodies, right? Every body is different, and everyone's going to have something different. I do like to go by time, so you're not counting your breaths, because then that kind of takes away some of the fun. Because you can also use this as your like meditative time. You can use this as so many other things. Once you first, like you said, fall into your space, figure out what your body's doing, and then now you can rely on your pelvic floor to be doing these 2,200 reps or whatever, however many reps you're going to do. But yeah, in the beginning, really I say time, and then like check in with yourself. It's one of those, how's my posture? How's my breathing? Which is also a really, really common thing to do now. Like people are becoming more aware of how important it is. It's so fantastic. My best friend's on here, Courtney. She like teaches breathwork classes. Like it's
Courtney,
hey girl, it's like a thing because we don't breathe. You have to have someone teach you, which is fantastic.
No one taught us how to breathe or walk or run. Like,
yeah,
is that the craziest thing? We don't know how to walk, run, or breathe.
No, and we can it's
crazy. So okay, so anyone out there, if you have any questions, definitely ask right this second, because we're about to hop off. That was just so valuable. Like, I love the 5 minutes on the clock. Everybody is different, and making sure that men actually have exercises to go to, because I don't think people cue men enough.
Mm-hmm.
It's always just like, I'm trying to think of a word that's like, a stereotypical workout doesn't include male pelvic floor technique.
No.
So if this made a difference for one person today, like that would be worth it, right? And we all don't realize, when you get more competent and efficient in one area of the body, it changes the whole ecosystem that you are. And then your lifts might feel easier. Your run will feel better. Your movement will actually benefit from you gaining control over all of your body parts, not just the ones that you can see all the time.
Totally.
Right? So just so important, and such thank you for your time. It's just been so awesome.
Yeah, you're so welcome. And like, not only you're gaining control of the most proximal part of your body, like the most central, so like your pelvis, your abdomen, your breath, like this is where life is, right? Like this arm over here, you can live without it.
Yes.
Right? Like this is where strength and control comes from. So it's, definitely best to have an understanding and control of that. I don't know what it feels like as a guy to hold your pee, but I remember I was taking a boxing class, and the instructor was like, he didn't speak very much English, but he just said, hold your pee, hold your pee, hold your pee, which is, and I could barely tell what he was saying, but I was like, this guy's talking about your pelvic floor, and he was, I don't even actually remember where he was from. So that was one, and I was like, heck yes. And he's coaching a lot of dudes, so he is saying something. But then there is just the hold part. And maybe if he were not trying to speak English, he would have talked about the relaxed part too. But he was addressing it. So it was really cool because they're getting freaking punched all the time.
Don't go about your whole day like that.
What did you say?
Don't go about your whole day like that.
Don't hold your pee all day. But that is like a cue I was understanding, and I was, super happy about that. So yes, I think the lift or the blueberry, whatever, just do it on the exhale. And that's been like the biggest thing for people, is I think they were doing it backwards. Yes.
Just gonna reiterate. That was so awesome. Thank you so much for your time.
You're so welcome.
Yeah, happy Tuesday. And you guys, reach out to Lauren at Thrive Physical Therapy SD. Ask her questions. She's all about this life. Go follow them on Insta. Check out their website. If you're in San Diego, they're open. Anything you want to say about your business or sessions or anything? Yay.
We're moving soon, but not very far. Right now we're in Hillcrest, but hopefully we're moving to, I'm like, realize I have so much face oil. We're moving to Bankers Hill, hopefully a little bit more space. So no, come join. This is what our thing looks like. It's me, my husband, our dog Gus, and our 2 admins. And so it's pretty chill, mellow spot. And our new spot will have all the more equipment. We have a squat rack just sitting in our backyard waiting for it to go somewhere. So come on in. We will do all this stuff. The type of physical therapy we do is like, yes, like I do pelvic floor therapy, and we also lift. Like you got to learn how to do that. So this is not a come to me, you're going to lay on the table and you're going to like breathe for hours, which is a great thing to do. Just not here. It's not physical therapy, right? You don't get to learn how to move. Physical. There's
physical.
You got to do it. So anyway, come on in, ask me questions, whatever you want.
Okay, thank you for your time.